to be able to see it. Good afternoon. The question we're trying to answer is, in what way is it innovative? What can virtual reality contribute to training in occupational health and safety? My name's Sergio Bravo. I am a safety technician and trainer with more than 17 years of experience. And in these 17 years, one of the most significant and revolutionary changes I've seen in training on these topics has been virtual reality. Ludus is a company from Bilbao. We're from right here in the center of Bilbao. Well, maybe not exactly the center, but almost, as people around here like to say. We've developed this platform that we're going to show you, which offers virtual reality content. This is the platform. We have it available in both English and Spanish, and there are 20 virtual reality topics focused on health and safety, with more than 500 exercises related to them. And the question is then, what does virtual reality add to traditional theoretical and practical training? Well, that's exactly what we want to show you. So we're going to do it directly, without PowerPoint, which is already an innovation. Virtual reality allows us to bring very dangerous situations, very hazardous jobs, into a classroom without any real risk. It also allows us to, look, this is a simulation that we have for working at heights, and it allows us to change the setting, choose exercises. For example, I'm going to choose a scenario in this case, which is a jib crane, a construction crane that we're all familiar with. Just the fact of being able to expose a student to a height of 50 meters before they actually go up could reveal if they have vertigo. There are people here who try to grab onto the bar, right? Because you don't notice it as much on the screen as when you actually put on the goggles. Here, the main character is the student, and in many cases, they would be feeling that sensation of vertigo. If we detect it beforehand, we can prevent very complex situations. I've had to carry out real rescues during theoretical practical training sessions because people have panicked. There are people who don't know they have acrophobia. Not vertigo, by the way. It's not called vertigo. It's called acrophobia. Another advantage of virtual reality is that it even allows you to carry out a procedure correctly or incorrectly. It's not imagine you're on a rooftop, it's you are on a rooftop and you have to move to point X. You can do it incorrectly. In 2022, there were 69 fatal falls, and many of them happened this way. People who, instead of moving where they should, walk near the edge without hooking onto the lifeline, for example, and when they step on the skylight, what can happen? Fatal fall. Obviously, what you have to show students is that if they do things right, if they don't unhook themselves, use their personal protective equipment correctly, step where they're supposed to, not on skylights, not near the edges, but far from the edges, if for whatever reason a wasp comes and I trip, I might fall, but I'll be left hanging. In this situation, I haven't suffered a fatal accident. In other words, virtual reality allows us to introduce these kinds of situations and let them experience them. On the other hand, virtual reality lets us raise awareness among workers, which is one of the toughest jobs we have as safety professionals. Isn't that right? Many times, no matter how much information we give workers, we can't get them to truly learn, to really make the procedures their own and use the correct personal protective equipment. For example, we have this hand accident simulation that it allows us to raise workers' awareness in many ways about the different risks we expose them to. In 2021, there were more than 100,000 accidents related to fingers and hands, making them the most exposed part of the body. In LATAM, it's even worse. And in the Middle East, the statistics just skyrocket. So obviously, one of the key points is, should we tell them to use personal protective equipment? Yes. Should we tell them to use just any personal protective equipment? No. For example, would these gloves be the right ones? No, they're for chemicals. These, for example, are for electrical hazards. They're flame resistant. Obviously, these would be the right ones, and if you use and choose the equipment correctly, nothing will happen. However, as we know, in many cases, this isn't the usual practice. For everyday work, like when you're punching a metal plate, nobody or almost nobody uses gloves. They don't check the tools either. Here we have, for example, a hammer that's in bad shape. If I don't use the right hammer, which I have right there next to me, but I didn't see it, so okay, so I use the punch here. I get close to punch it, and 1, 2, 3. Oh, of course, since it was splintered, I got a splinter stuck in my hand. This is a minor accident, but obviously we need to warn them that it could have been much worse. In fact, let's look at a serious accident now, in this case. To really raise workers' awareness, sometimes they have to experience these risks firsthand. Even the trainers, we have a little button here that you can see, but the student can't. It allows us to trigger a distraction. In this case, what is it? A cell phone. You can tell them, no, you can't use your phone, and so on. The point is to distract the student, and as a trainer, you can activate it as many times as you want to distract them so that when they're about to change the grinder disc, they forget that they needed to unplug the grinder. It's pretty shocking to see yourself in first person without a hand. On the screen, it already looks impressive, but seeing the fingers here, I can tell you, it's even more so. As you can see, virtual reality also allows me to bring personal protective equipment with their proper markings, machines, and all kinds of tools into the classroom. For example, an overhead crane. One of the benefits of virtual reality is also that you can train without shutting down the machinery. A forklift, a lift platform, an overhead crane. If you don't have it shut down, obviously you'll be able to train much better and more economically, since you'll be cutting costs because the equipment isn't stopped and is still producing. It's even easier to see. Here we have a simulation for fire extinguishing can even be done with this simulator, which is a real fire extinguisher. We've simply attached some parts to it so we can insert the controls, then so that the person using it obviously gets a much more realistic feeling. On our platform, about 2,000 fire extinguishers are used each month. So if each recharge costs, let's say, 30 euros, since you send it out, they return it and recharge it, we're saving 60,000 euros on recharges. And all of this without making real fire. We welcome you to this tool. Here, the fire isn't real, obviously. No real fire, no pollution, and no need to request permits. All I have to do is follow the procedure. We can demonstrate it with different types of fires, different scenarios. The physical procedure of how it's done, that is, it allows us to teach both the theory and the practical aspects of how to use a fire extinguisher. And if I don't perform any of the steps correctly, I'll get a results screen. In this case, it's going to reactivate for me. No, sometimes it reactivates. I've done everything correctly except for one step, which is that when I put out the fire, I need to step back while keeping visual contact. Why? To see if it reactivates or not, which is exactly what I was waiting for. All right? Another advantage of virtual fire extinguishing is that it allows us to make mistakes. If we choose the wrong extinguisher, for example, here we have 2 extinguishers. I could choose either one because both are suitable for the type of fire, a type A in this case, right? If I choose a water extinguisher and accidentally spray the printer that was plugged in, what's going to happen? I'll end up in the hospital from an electric shock. In other words, it shows us the consequences of not doing the practice correctly in this case. So you'll learn twice as much, meaning both the correct procedure and the incorrect one, or the way it should be done. Ultimately, it allows us to make the training much more hands-on, which is exactly what students ask for and what satisfies them. The Catalan Institute of Health uses CPR simulation and has conducted a comparative study with traditional training. And this comparative study confirms that our tool, specifically ours, is more effective in the sense that knowledge is retained to a greater extent. Thank you. As well as knowledge retention and also satisfaction, of course. This is much more entertaining, dynamic, and practical. We can select the scenario. What it gives us is possibilities. This simulation, for example, allows us to choose the scenario, the mode, whether it's guided or unguided. That is, whether it walks you through step by step what you need to do, whether there's a defibrillator or not, whether there's a razor, whether the defibrillator is in bad condition, or if the person has chest hair. Patient with agonal breathing, that breathing, not breathing, or breathing in an agonal way. Meanwhile, the student can't see what we're configuring. By the way, they'd be seeing a room here, right? With the headset on. So the only additional configuration I need to do in this case That is the headset where I place the mannequin head, which even I didn't know where I was going to put it. The headset will know. So I'm going to move it a little further apart. In this case, I can just press the calibration button to do it. It would be done like this. I place the headset here. Set it in the position you like, and that's it. This is the most complicated thing I've had to do the whole time. All right, now I look toward where the patient is, and I can see exactly where they are. And you might ask, where are the controllers? Right now, we're using a hand tracking system. This little screen in front of us detects my hands. What does this simulation allow us to do? It lets us see if we're performing compressions with the right pressure, depth, and rhythm. If I do it too fast or too hard, you see everything turns red. Obviously, the rhythm and the depth need to be in the green. It also allows us to keep this hidden from the student. The best thing is for them to learn by seeing it. Why? Because that way they develop muscle memory for it. It also lets us decide whether or not they see the procedure, skip steps in the procedure, or add real-time actions. For example, having people around start causing distractions, which could easily happen and actually happens often in real life. You don't know, you have to do compressions on the abdomen. It might not seem like it, but they're actually pretty annoying, so I'm going to remove them in this case. We also have the option to make them breathe or stop breathing at any moment. As you can see, these are all possibilities. And these possibilities, let's do a full exercise so you can see, are what make the difference when it comes to more practical training sessions. The first thing I should do is check for consciousness, check for breathing, and perform the head tilt chin lift maneuver. They're breathing, but it's strange. It's agonal breathing. I'm going to call emergency services and tell them where I am and what's happening. And I start chest compressions as soon as I get that instruction. With the correct rhythm and precision, I can bring in the defibrillator by pressing a button. The instructor could do it themselves. We can also get it ourselves. Since I mentioned that he had a bit of chest hair, we need to shave him, because otherwise the pads won't stick. So I place the pads and wait for instructions. Do not touch the patient. What is the defibrillator doing? It's checking if the heart is actually fibrillating. Since it's fibrillating, meaning I'm treating her synchronously, what we need to do is reset it. How do you reset it? By delivering a shock, which it's going to ask me to give. Step back for a moment, please. Careful. And now I can continue with compressions. Once I finish doing compressions, which is when the ambulance arrives, basically the exercise doesn't end here. The ambulance doesn't actually arrive. That is, when the instructor decides it's over, here we have the statistics. Green, yellow, orange, red, it directly evaluates us on objective parameters. For example, the time that we took to do the compressions, the defibrillations, total compressions, etc. You can even remove steps from the procedure to lower the grade, meaning the score goes down, because in the end, what this gives you is a grade, even allowing you to assess with a short theoretical test. Well, I didn't get a perfect score, did I? In short, this is what we came for and what we wanted to show through these demonstrations. Well, virtual reality is a very innovative tool. I started out with a chalkboard. Then I moved on to the computer, like many of us here, right? And this, obviously, clearly, for me, is the next evolutionary step in educational tools, because it allows us to go, and does go, beyond what traditional, theoretical, and practical training can offer. The future was already yesterday. Ludus's clients already know this, and that's why they choose our technology and are at the forefront of practical, high-quality training. We hope you enjoyed this presentation. Thank you very much.